Childhood obesity is one of the most common chronic diseases facing pediatricians in the U.S., according to the American Academy of Pediatrics. The CDC reports that the rate of childhood obesity has more than tripled since the 1970s, affecting more than 14 million children today. These kids are at risk for type 2 diabetes, high blood pressure, heart disease, and even some cancers. While there are many different factors, the World Health Organization is pointing a finger at the food industry. In 2017, U.S. food, beverage, and restaurant companies spent nearly $14 billion promoting fast food, sugary drinks, candy, and ultra-processed foods to the American public. A good chunk of this was advertised directly to kids.
Fruits and vegetables and food in its natural state is just not promoted. It's not marketed in the same way. So there's something that I have said before, which is an unfortunate thing to say, but if it's marketed to kids, it's probably not good for you.
That's Frances Fleming Milici, Director of Marketing Initiatives for the Rudd Center for Food Policy and Health at the University of Connecticut. She studies the marketing of food to children and says that the ways to reach them have grown exponentially in recent years. In addition to billboards, radio, and TV commercials, food and beverage marketers have begun to utilize social media.
The type of marketing that's happening there is very different than the traditional type of marketing and advertising that we were all sort of familiar with, because the content and the marketing is sort of blurred together there. So you barely see a line between what is entertainment and what is marketing or advertising.
For example, kids play a lot of games on social media created by food marketers.
And it would involve a cereal or a candy brand, or they're in Roblox in this metaverse content, and they're actually in worlds that are fast food worlds or sugary drink worlds, and they're kind of moving through the space in an immersive way that is just completely different to the way promotion, advertising, and food and beverage promotion was presented in the past.
And these marketing efforts are paying off. Dr. Ashley Gerhardt says that ultra-processed foods account for as much as 60% of the typical American kid's diet.
That's actually going to vary a lot because we know our access to healthy and nutritious food is impacted a lot based on our social status. So people who have more money, who are in richer neighborhoods, are more likely to have access to healthy, nourishing foods. And especially communities of color, under-resourced communities, really the only source of calories that many people in those communities have are these sorts of ultra-processed, fast food, highly convenient, highly rewarding sort of products.
Gerhardt is an associate professor of psychology at the University of Michigan and director of its Food and Addiction Science and Treatment Lab. She says cravings for these ultra-processed foods are not unlike an addiction to tobacco.
When we look at the evidence for how we designate when a substance is addictive, using things like historical debates in the past about whether tobacco was, just a bad habit or whether it was truly addictive, when we look at those sorts of criteria, to us, it's clear that these ultra-processed foods that are high in refined carbs and fats and sweeteners, that they really have very similar impacts on behavior, the ability to trigger compulsive behavior where you can't stop even though you want to, and encourage really intense cravings and desires, shift your mood through their impact on the brain, and that we want them. We find them reinforcing. We find them appealing. We'll go out of our way to get them. All those criteria, we see ultra-processed foods meeting those.
Gerhardt's research shows that 12% of kids in the U.S. meet the clinical standards of addiction to these foods.
1 in 10 kids are showing signs of a loss of control over their intake, intense cravings, continued use despite negative consequences. And it's continuing even though they report that they're really feeling either very distressed or very impaired by it.
This statistic has grown despite the U.S. Department of Agriculture's efforts to promote the healthy food pyramid, a balance of fruits, vegetables, grains, proteins, and dairy. Fleming Milici suggests that one way to combat the problem is to restrict kids' access to television and social media. However, she realizes this is impractical and places too much of a burden on parents. She'd much rather see policy changes at the federal level that protect kids from aggressive food advertising. Food marketers currently self-regulate through an organization called the Children's Food and Beverage Advertising Initiative. But Fleming Malici says it's not effective, not by a long shot.
That was designed to, they use the term, shift the mix of what is advertised to children, I should say. It is something that the biggest food and beverage companies belong to, but it has a lot of loopholes in it. And so people or companies are adhering to the policies that have been set forth, the types of foods that can be marketed on child-directed media, but it's not really protecting children from unhealthy food marketing at all.
Fleming Malici says researchers are working with advocates and policymakers to change the food marketing landscape. And while it may take some time, she's hopeful new restrictions will contribute to healthier generations of Americans. One limit she'd like to see is banning companies from putting images of fruit on packaging for products that are only fruit flavored.
And that's a common occurrence, too, on the front of package of child-directed sugary drinks. There's lots of fruit on the front of the package and characters, maybe to attract young people, children, but also the fruit can be there to attract the parents. And it sort of looks quite a bit like, from the front of package, from the 100% juice product, but it's actually just a sugary drink. And in that case, you're marketing a children's product to parents by making it look like it's a healthy choice. All parents want their children to be healthy. And the marketing undoes or is something that can really undermine parents' best efforts.
Join us next week to learn how you can fix the bad habits within your diet. You can find more information about Dr. Ashley Gerhardt, Frances Fleming Malici, and all of our guests on our website, radiohealthjournal.org. Our writer-producer is Polly Hansen. Our lead producer is Kristen Farah. Our production manager is Jason Dickey. I'm Nancy Benson. This segment is brought to you by Capital One. With one of the best savings rates in America, banking with Capital One is the easiest decision in the history of decisions. That's banking reimagined. What's in your wallet? Terms apply. See CapitalOne.com/bank for details. Capital One, N.A., member FDIC. Coming up next week on Radio Health Journal.
When I asked researchers, why aren't you studying women? Like, what's going on here? Most often the answer is that it's because of the menstrual cycle.
Why are male bodies the standard for medical research?
Then switching kids to plant-based whole foods for good health.
In the world of getting children to eat vegetables, just keep putting more vegetables on their plate. Don't give up. Don't cave in. If they say, but I only want chicken nuggets, don't believe them.
All that and more on Radio Health Journal. I'm Elizabeth Westfield, host of Radio Health Journal. If you enjoy listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
We're told every day, mostly on the internet, that if you can't pronounce the name of a chemical, it must automatically be bad for you.
What does the long list of ingredients truly mean? Then,
was there a time when you really needed me and I didn't come because I was working?
Taking time this Mother's Day to recognize the many challenges of motherhood. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Viewpoints on your favorite radio station, iTunes, and Stitcher.
And that's Radio Health Journal for this week. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.